some of you may have been at the seminar last November, which we did on Building Hope Collaborative Carer Skills Workshops, and that being looking at the support skills-based group work chance for reflection for carers and loved ones, which is actually separate from treatment. Like, it's a very important service, but it's actually not linked to treatment. But that led people in asking about, well, what are the services in actually involving families within the treatment services? And our eating disorder coordinators were asking for that. Could we actually have a look at that? So we came to thinking, well, what's the best way we can do that? Being that the research, and it's a very evolving field about what's actually happening in the adult sector. There's been more research done in the evidence base for family-based treatment for the child and adolescent population, and there has been research done, but in terms of what models, what ways to actually involve families, carers, partners, it's still a work in progress, and there's some really valuable work happening here in Melbourne and in the state. So hence we got to this position in actually thinking about the seminar today, and there's a number of people, and I hope nobody feels left out, but I thought, well, the 3 public mental health eating disorder specialist services, that's the place to start, because I know they're actually been developing their services to involve families. So as I said, I'm going to just talk at the beginning a little bit about the actual history and context about what's influenced actually how families might be involved in eating disorder treatment over the years. And some of this you all know, but I just thought it was very interesting when I went to actually put this together and think about, well, what are some key things that actually inform us what we do? I thought there's such a body of influences that really lead us to where we are today. Now, some of you will actually seen some of this information before, but I thought, like, this little almost 140-year history from actually the time of Gull in 1873, where relatives and friends were seen as generally the worst attendants, and really seen, you know, we had the time where parents and families should be separated and people should be taken away, and families were actually seen as quite a problem within the treatment. And even back in the 70s, and I really admire Manuchin Works being a family therapist trained in structural family therapy. There's a lot to offer there, but it was still a bit of a view about the family system. It was around the family, the way it was organised, its communication and the over-involvement that were actually really significant in impacting on the young person's illness and eating disorder. And then leaping ahead to the work in the child and adolescent field with the group at the Maudsley Hospital in London in their family-based treatment of really looking at what's going to assist most. And a lot of you here will know about family-based treatment, but one of the things that's very relevant to this today we're talking about is that it really was looking at that families are an essential part in the recovery and the empowerment of parents, and seeing as a resource to recovery, that they're not causal to the illness. People might respond in various ways because it's such a distressing illness that people might behave in ways sometimes that are actually can seem to be maintaining the illness, but really we need to help people actually to empower them to support their loved one and take charge. Despite all those changes, I guess we could say, there's still been, and the things that have happened along the way about why it's hard sometimes in adult system, and those of you here that work in adult system, it's a few years since I've worked directly in the mental health adult system, but, you know, there's always an issue around respecting the independence and privacy and the rights of an adult individual, so it's always balancing up those sort of factors, and knowing for some people who is their family, like who do you include, because our family systems are somewhat changed today in terms of the step families, the really different amalgamations of families, or is it a partner or is it the parents? So we've just got to decide who that might be. And in our service systems, and I know in the time that I've worked in mental health, the change of working at how do families actually, are they central to the work? Are they foundational in the way we see our work with the clients? Or are they something that's an extra that we involve? And so how we think about that has been something that the service system has need to think about. So when I tried to pull together what are the things that I thought are actually happening that actually inform things today, there's actually such a range of things that come to this point today we are in Australia and in the world. And I'll just list and I'll go through a few of them. But, you know, the recovery framework, there's so much analysis in looking at carer burden and the impact of illness. The new Mental Health Act, NEDC, if people know about the National Eating Disorder Collaboration, I'll come to in a moment. Bouverie Centre, of course, has led the way in looking at in any illness having family and loved ones involved. And, of course, very importantly, the evidence of the person, the carers and the clientele themselves, and research. People here be familiar just looking at actually the frameworks for recovery-oriented practice. And there's 9 domains there, but just pulling out one of those, of the 9, about family and carers, just seeing them as really significant in their support role, and also that they need to be support as well. So it's embedded in that, and all the services, and your service is probably at different stages of including recovery-oriented practice within your work. And of course, this is a government policy. The new Mental Health Act, and this is about to come into practice, I know, and some of you will have, who's read the whole Act? I haven't, but when I looked through the summaries of it, and when I was looking, what are the things that are said about families, I think there's 3 key areas that come in there that actually talk about, in the first one there, about the role of family, like that's really got to recognise the importance in their role that the carers and families have to undertake, and encourage the partnerships there. And the second point, I think, really talks to actually their needs to support in relationships because of the stress of the illness, that really enable service to assist the patients to kind of keep up their relationships with family and supportive relationships. And the third part is really important about the decision making, is around how families and carers should be involved in both assessment, treatment and all the decision makers along the way. And people would be aware that's very much part of the Act, that an individual sufferer of any illness actually has a carer and a support person as part of the actual process of decision making. So role, support and decision making really critical in the Act. Then we look at the National Eating Disorders Collaboration, and they've just done so much work looking at practice and the needs of both sufferers and families. And they have 7 core principles of prevention and treatment. And one of those is about family and carers. So when we look there, it's really looking at everything about how they're integral to the team, so not just the adjunct, but actually central to the team in supporting a person with an eating disorder. And we need to take account of that if somebody hasn't got actually a loved one to be involved. So that's kind of in our policy, and then looking at the work of NEDC, and then there's the whole research going into carer burden. And just wanted to put 2 different areas in here. One is from this research of Graf et al., and this is published in 2008, but sort of talking about, if we compare eating disorders to schizophrenia, really, because everybody understands the burden and the impact of the illness of schizophrenia, but when it was looked at for people with eating disorders, they have similar problems and similar levels of unmet needs that need to be addressed in our clinical practice. And there's a number of statistics there which I just put in case you hadn't read this from the actual Deloitte Access Economics report that the Butterfly Foundation commissioned that came out last year, Paying the Price, the Economic and Social Impact of Eating Disorders in Australia. And this report actually has been, I know, quoted and looked at overseas because it's one of the most extensive reports that's been done to look at what's the burden of eating disorders. And so it's social and economic, but I just wanted to point out, one, I think there's amazing statistics here in the number of people with eating disorders, but this figure they'd worked out that on average it's 12.4 hours per week that if you have somebody with an eating disorder, you'd be involved in caring for them. And this Centrelink, this is the carers registration, 525, and that's just people registered. We'd all know there's lots of other people who are out there caring with somebody for an eating disorder that aren't registered for carer. So I just did this simple maths here about those number of hours, those number of carers, and that alone is that the lost opportunity for those people to work and have an income, just in the economic sense if they're actually having to stay at home and care for somebody. And these are just a couple of quotes from that same report, looking at the financial emotional cost. And people even talking about it sort of at times this feeling like it's irreparable, and the exhaustion and even marriage breakdown. I think you all have met families where actually that has led to separation of parents, the stress on couples, and noting it's the entire family. We're not just talking about parents here, but siblings. And I know EDV have done a lot of work looking at the impact of siblings, and they did a report last year particularly focused on that. so that everybody in the family needing to be involved and learning skills to cope. So thinking of the positive, that Bouverie, in this their general work in families, and people here in your services, they've been running their family sensitive practice for many years throughout the Mental Health Services Victoria, but these 7 principles that they have in their family sensitive practice for everybody would be just echoing a lot that's come out of the work that's done by the carer consumer groups and reports. So I think we will, in any illness, we're working for all of these things about respecting, involving and the empowerment, and of course understanding the subjective experiences within that. Then we look at the influences of leaders in research, and those of you that came to the Collaborative Carer Skills Seminar in November, or a lot of you might have read of the work of that group, and I've got a couple of books here that if people haven't seen them, have a look later. This is the book, Skill-Based Learning for Caring for a Loved One with an Eating Disorder, which is for the carers, and this one is the Clinician's Guide, which is a companion one for that. Valuable books in actually looking at supporting carers and family, and Janet Treasure in that group has been working for many years now, since, I don't know when she started. Janet's been working eating disorders for a long time, but in the last, I'd say, 10 plus years, the work in these publishing and having resources available. Cynthia Bulak, who was recently in Australia at the Carers Conference in Brisbane, has done work on her UCAN, the Uniting Couples in the Treatment of Anorexia and Nervosa. So that's a whole new body of work to actually how to work with couples, which hasn't really been addressed so much before. And Ivan Eisler with Whitney also is looking at what are the best models and how do we actually help somebody that's caring with a person with an eating disorder. So there's a few. If you haven't read any of the work of these people, I'd really suggest it's very useful to kind of get some grounding in what we actually might understand and how we best support and help and build up skills for people. And just coming to the end of this, of thinking amongst all the work that's happened, that the worldwide charter that's been put out for action on eating disorders, that has 6 rights for individuals and carers, and 2 of those specifically relate to carers and family. So again, we're echoing a lot of the ideas that have come from the other sources as well, but looking at being informed and valued and respected as part of a treatment team as a resource, and having accessible, appropriate support and education. I think that probably summarises a lot of the points that have come from the other work as well, of just saying these are key issues that actually need to be happening to support carers and families. And lastly, looking at, when we come back to where we're going to be talking about today, what are the service developments in Victoria? So Kim's in the CAM system have actually been adopting using FBT and increasing family involvement, where the parents are viewed as a resource, in the Children's Hospital here, and I think I saw Stephanie Campbell somewhere around the room. From the Children's, been a key people actually doing the research in Victoria, and SEED has been working in training and supporting the CAM services around the state. The Building Hope Collaborative Skills Workshop is a carer skills work that's happened through EDV, and some of the services like Royal Melbourne have been offering, and I think Bettis before had that service offering. And what we get to today is the specialist eating disorder services, which I've invited today, have actually been developing. How might we involve family carers into the work we're doing to help them support and improve their quality of life and the outcomes for themselves and their loved ones, might be involved in eating disorder treatment over the years. And some of this you all know, but I just thought it was very interesting when I went to actually put this together and think about, well, what are some key things that actually inform us what we do? I thought there's such a body of influences that really lead us to where we are today. Now, some of you will actually seen some of this information before, but I thought like this little almost 140-year history from actually the time of Gull in 1873, where relatives and friends, now eating disorder coordinators, were asking for that. Could we actually have a look at that? So we came to thinking, well, what's the best way we can do that? Being that the research, and it's a very evolving field about what's actually happening in the adult sector. There's been more research done in the evidence base for family-based treatment for the child and adolescent population, and there has been research done, but in terms of what models, what ways to actually involve families, carers, partners, it's still a work in progress, and there's some really valuable. Some of you may have been at the seminar last November, which we did on Building Hope Collaborative Carer Skills Workshops, and that being looking at the support skills-based group work, chance for reflection for carers and loved ones, which is actually separate from treatment. Like, it's a very important service, but it's actually not linked to treatment. But that led people in asking about, well, what are the services in actually involving families within the treatment services that ever work happening here in Melbourne and in the state. So hence we got to this position in actually thinking about the seminar today, and there's a number of people, and I hope nobody feels left out, but I thought, well, the 3 public mental health eating disorder specialist services, that's the place to start, because I know they're actually been developing their services to involve families. So as I said, I'm going to just talk at the beginning a little bit about the actual history and context about what's influenced actually how families were seen as generally the worst attendants, and really seen, we had the time where parents and families should be separated and people should be taken away, and families were actually seen as quite a problem within the treatment. And even back in the 70s, and I really admire Manuchin Works being a family therapist trained in structural family therapy. There's a lot to offer there, but it was still a bit of a view about the family system. It was around the family, the way it was organised, its communication and the over-involvement that were actually really significant in impacting